Today's video, we will be discussing about one of my favorite methods of engaging patients during the wait time and how I implemented that in my clinic. Let's discuss that today. Hi guys, welcome to LDFS. I'm Dr. Lakshmy. Today we'll be discussing about one of my favorite methods of engaging patients during the wait time. Now, there are hundreds of methods to do it, and we want to engage patient during the wait time so that their perception of wait time is less. Now, if you didn't understand this term perception of wait time, kindly check my earlier video. The link is there in the description below, where we have explained what do you mean by perception of wait time. So in today's video, the method which I am going to discuss is engaging the patients during the wait time with the help of assistant dentist. Now, before going into how I implemented this method in my clinic, I would like to share with you guys my experience of facing this method as a patient in another hospital. So when I was visiting Arvind Eye Care with my mom for a consultation with a specialist, we did our registration and we were asked to wait in the waiting area. After some time, we were called into a chamber where our assistant doctor was there and she checked her power of the eye. After that, we were asked again to wait outside. And then we were called into another chamber where another doctor, who is an assistant doctor itself, she took all the history of the patient, like what was her chief complaint and all the reports which she has conducted earlier. Everything was compiled into a file and kept ready. Then we were again asked to wait outside. And finally, we were called into the specialist chamber. And when we went inside, the specialist had all the things ready. The power reports, the earlier reports, the history, everything was briefed to him. The whole consultation with the specialist was around 5 to 7 minutes. That's it. But it was crisp and to the point, and it was very satisfactory for us. So if you think from my point of view as a patient, the total wait time actually was of 45 minutes. But we felt that the wait time was hardly for 10 minutes or 15 minutes. The reason was we were continuously engaged by one or the other doctor. And it's a win-win situation for both patients and doctor, because the specialist doctor didn't spend much of his time talking to us and collecting all the details and doing the power test and all those things. He directly jumped into the diagnosis part. Everything was conducted by the assistant doctors and everything was briefed to him. Now, the same method we can apply in our clinic also. Now, let's see how I implemented this method in my clinic. I will explain this with the help of an example. Imagine I am doing a patient and that appointment patient is taking a little longer time. And my next appointment patient, checkup patient, is waiting outside. Now I will ask my assistant dentist to engage that patient during the wait time. My assistant dentist will go ahead and take all the case history from the patient. She will collect what is the chief complaint of the patient, what are the history of pain and how the symptom was, everything will be collected. She'll collect all the medical history of the patient. She'll collect any other x-rays are there and everything related to that case. If he or she is my earlier patient, she will keep ready all the other case histories which are there, when the treatment was done, what treatment was done, everything will be kept ready. And if any x-ray is required to diagnose the case in today's consultation, she will take that x-ray and keep it ready. So imagine when I am completing this case, And going ahead with the consultation part, I have everything in place. My case history is there, medical history is there, complaints, symptoms, x-rays, everything is there. I can directly jump to the diagnosis part. Now, this is a win-win situation to both patient and myself. Patient is happy because he or she is engaged from the time they have entered into my clinic, and I am happy because my time is saved and I won't be late for my next appointment. So both of us are happy. Now, this can be applied to any other appointment patient or the treatment patients also. So if imagine rather than a checkup patient and treatment patient is sitting, then my assistant dentist will take up that case, start the case and keep everything ready. If it's a BMP case, for example, she will start doing the hand filing and everything. And by the time I'm completing this case and going to that case, then I continue what she is doing. So both of us are happy. The patient is happy because they have been engaged. I am happy because my some time is saved. So this was the tip. And I hope you like this method. Kindly like, share, and subscribe us, and let us know in the comment section what are your different ways and your favorite ways of engaging patient during the wait time. And if you have not enrolled to our broadcast list yet, kindly send us a hi on WhatsApp on this number. We'll add you to our broadcast list, and you'll be the first person to receive any free content which we are releasing. Then only we will release it to the rest of the world. Thank you so much, guys. Bye.